Fallopian tube is a structure which connects ovary to the uterus. Every month of the cycle, ovary forms an egg which is being released during the ovulation into the peritoneal cavity, and it is being taken up by the fallopian tube. If during that time the couple have a sexual intercourse, sperms are being released into the vagina, from where they travel from the uterus to the fallopian tube. And if the egg is present at that time, they meet and a natural fertilization occurs in the fallopian tube. That's a very important role of it. Along with it, during that time, for 2 to 3 days, the embryo develops in the fallopian tube, and then it travels from the fallopian tube into the uterus. So these are also the functions of the fallopian tube, that is the growth of the early embryo. Along with it, its travel from the fallopian tube into the uterus. So for the growth of the early embryo, there are the glands present in the fimbriae which release the secretions and present in the fallopian tube, and these secretions help in the early development of the embryo. As well as there are the cilia which are present in the fallopian tube which travels the embryo from it to the uterus. The most important pathology in the fallopian tube which leads to infertility is the infection. In this infection, not only the fallopian tubes get blocked, these cilia and the glands are also impaired. Therefore, even if we anatomically clear the blockage in the fallopian tube, their patients are still not able to conceive because the cilia and the glands are not being replaced. Other than the infection, there can be a blockage due to endometriosis, there can be a blockage because of tuberculosis, or there can be other adhesions because of other previous surgeries. Even in the women who have undergone an abortion can have an pelvic infection leading to a blockage of fallopian tube. What are the different tests used to check the patency of fallopian tube during the female partner evaluation? There are the three most common tests used, which are: first is hysterosalpingography or HSG. This is the most common test used in most of the fertility clinics. In this test, a radio-opaque dye is injected into the uterus, and by using an X-ray machine, we capture the film of the uterus and the dye movement through the fallopian tubes into the peritoneal cavity. And this is a comparatively easy and a less costly test. Most commonly tests used are: first, hysterosalpingography or HSG. In this test, a radio-opaque dye is injected through the uterine cavity, and using an X-ray machine, a picture is captured of its movement through the uterine cavity to the fallopian tube and into the peritoneal cavity. This is the most commonly test used among all the fertility clinics. After the test, there are certain antibiotics given to the patient along with the painkillers. Second test used is sonosalpingography. This test is used with the help of ultrasound. In this, the ultrasonic dye is being injected into the uterus, and the movement of it is seen onto the ultrasound. Other than the dye, this normal saline can also be injected, and the fluid movement is then seen through the ultrasonography. It is now an upcoming test and being used in the fertility clinic because it doesn't require an X-ray machine. The third test is the laparoscopy, and that is a gold standard test. In this test, a laparoscope or a small camera is installed or introduced into the abdominal cavity by help of a small incision on the abdomen. And through this camera, then we see how is the structure of the fallopian tube, whether it's free, how is the motility of the fallopian tube, and whether it is patent or not. It is considered to be the most accurate and the gold standard test for checking the fallopian tube. Once after checking the fallopian tubes, we need to assess the status of the fallopian patency as well as the quality of their working, and according to that, the different options are being given to the patient. If they are normally working, then we can assess the working capacity of the fallopian tubes. Hence, we can decide the options for the couple for the further treatment of the infertility. Even after patent fallopian tubes, some couples are not able to conceive after multiple cycles of IUI or natural attempts at the pregnancy. These couples are suggested for going into the in vitro fertilization because this process doesn't require fallopian tube, and the fertilization happens artificially outside the body, and it carries a much higher successful rate. For further queries regarding IVF or for the evaluation of the fallopian tube, you can call or message us.